The Fractora radiofrequency ablation. Positively charged pins generate an ablative crater, and then the RF current travels from the pin to the negatively charged electrodes, creating an ablation, a zone of non-ablative thermal coagulation, and a zone of passive remodeling. We're going to do a live Fractora resurfacing treatment. We're going to use multiple applicators, the 3000 coated, the 3000 uncoated, to demonstrate the immediate tissue tightening and the epidermal thermal sparing effect. And then right over top, a more superficial mid-density 60-pin 600 micron treatment. This is the device itself. This comes in numerous platforms that are very versatile that you can plug various applicators into and modulize and build your own complete aesthetic unit. With the new in mode, you can have diode, high-speed, pre, interim, post-cooling hair removal, IPL, Fractora, total tissue resurfacing. You can have the non-ablative firm product that does non-ablative RF tightening that's thermally modulated, and then the tight effects, thermally modulated permanent cellulite reduction and permanent adipocyte apoptosis or fat killing. We're going to do the Fractora first. As you can see, this is the handpiece. The handpiece is re-sterilized with a simple 70% isopropyl alcohol cleansing after. It has a cord and then an end that plugs into the machine. You simply take the cord and plug it into the machine and twist, and suddenly it recognizes different opportunities. Again, I'll unplug that, and when you unplug it, it says no handpiece detected. You take the end of the cord, plug it into the machine, and twist, and now it recognizes different opportunities. You simply dial down with the menu button to what you want. This is body tight, which is the radiofrequency assisted liposuction. You can go down to the face tight, neck tight, and we're interested in Fractora, fractional resurfacing. Once you hit Fractora, you simply hit the check, and up comes the Fractora software. There's the 20-pin, 24-pin, 60-pin, and 126-pin opportunities. You simply dial in whatever pin number you're going to be using, and then how many millijoules per pin you want. And today we're going to start with the 24-pin, and we're going to go up to 40 millijoules per pin. I'll use this as high as 60 millijoules per pin. I find over 40 to 50 millijoules per pin you need to go from topical and a chiller to some type of nerve block or regional infiltrative anesthesia. We're going to use 1 pulse per second. You can go as high as 2 pulses per second. Very hard to keep up with a large applicator at that speed. I find the 1 pulse per second effective, and you can do the full face in about 5 minutes. It'll keep a tally of the number of pulses that you use. Now you simply, before you hit the check button, you select the tip that you want. We're going to start here with the coated tip. We're going to use the 3000 micron silicone coated tip. This is 24-pin, 3000 microns deep, and they're silicone coated, so the distal 800 to 1000 microns is releasing the RF energy, epidermal thermal sparing. You can see the negative side electrodes are sort of spring-loaded, and they, as you press hard, it stretches the skin, creates a tensile load in the skin so that these very deep needles can easily penetrate. Each of these Fractora tips comes with a positive electrode insertion point. You take your handpiece, which is a male-female sort of coupling, and you simply insert and insert to the end, and now you're ready to go. It is foot pedal powered, so you simply go back to the machine, hit the check button, and up here it says ready, and now you're ready to go. So let's start with the 3000 micron 24-pin at 40 millijoules per pin. This is 3000 microns. So let's move back over to our patient. We're treating our patient today. She's had about 15 minutes of BLT, benzocaine, lidocaine, tetracaine. You may also deploy a chiller. And in fact, if you're going to invest in any fractional optical system, erbium or CO2, or the Fractora, you need to invest in a Zimmer cooler as well. Today we're going to be using topical anesthesia without the Zimmer cooler because it's loud and it would be difficult for me to educate over top of it or to demonstrate over top of it. So let's move back to our young lady. As you can see, she's a light skin type 5 patient or a dark 4. Let's zoom in a bit. And there are some issues we want to achieve, some tissue tightening and some textural improvement. We are going to be using the 3000 micron, zoom in on that, silicone coated first. And she's got her topical anesthetic cream. And if this is a real live clinical situation, to make it even more comfortable, pre-cooling with a two-handed technique or a technician helping you. Usually you can use it two-handed to pre-cool as you're treating. So let's go to our first test spot over here. Always test over on the side. Make sure that patients are accepting of the energy that we're going to treat with. We've already cleansed the skin with some alcohol wipe and dried it off with a gauze. And we're going to take our 3000 micron tip here. And generally you can have the negative electrodes facing sideways or up or down. Either way is fine. You can zoom in a bit there. Perfect. And I'm going to put a little bit of, put that in the center of the screen. Excellent. A little bit of pressure now, so I stretch the skin a bit, a little bit of pressure. And then once I've got the pressure, I put my foot on the pedal with silicone coated and I penetrate. Now once I'm there, I do a second and even a third pulse. 1, 2. The reason being the first pulse guides the needles deeper into the skin. The second and third pulse are delivering the deep RF effect. And you can see that the skin is attached as we lift it off. We overlap about 50%. You do not want 2 negative electrodes touching each other. If you overlap 100% and 2 negative electrodes touch each other, too much RF current going to that negative electrode, and you're going to get a little stripe of epidermal lysis, superficial epidermal loss, electrical microdermabrasion essentially, but you get these little stripes that then take longer to heal because they're non-fractional. So with Fractora, I like to overlap 25 to 50%. Okay, now we're going to go to, you can see the erythema and the edema of that patch. We overlap about 50%. I push and then a pulse. You can feel a little impulse as the needles go deeper. You're pushing firmly with the 3000 micron, then 2 pulses. 1, 2. Lift up. You should have some attachment. Overlap about 50%. Push. Pulse to get you down there, and then 2 pulses for deep tightening. Lift, and you can see a little bit of blood, a little bit of heme. That heme is there because of the needle stimulation of the epidermal dermal surface without the coagulation. With the 3000 micron uncoated, you don't tend to see that because the first part of the penetration, of course, is mechanical, not thermal. So always have a little bit of gauze, dab that, and again, overlap 50%, push. Now you're getting penetration with a non-thermal silicone-coated needle. Your deep needle is already under the epidermal dermal surface. Now you do a pulse to set it, and then 2 pulses. 1, 2. Come out. Again, overlap 50%, firm pressure, push. Now you're under the epidermal dermal surface, pulse to get down, and then pulse, pulse for your deep ablation. Chin up just a bit there, young lady. Keep turning this way. And then overlap 50%, push, pulse, pulse, and off. Overlap 50%, push, pulse, and that gets you down, then pulse, pulse for the ablation. Okay, there's our first line, a tremendous amount of edema, but not a lot of crater ablation. You don't see the crater ablation with a silicone-coated device. Again, we're going to push and then pulse, pulse. Overlap 50%, push, then pulse to get the needles down. Once you've set them 3000 microns deep, pulse, pulse. Overlap 50%, push, and then pulse, pulse. Overlap 50%, push, pulse, pulse. Overlap 50%, push, and then pulse to set the 3000 micron depth. Non-thermal epidermal penetration, then deeper thermal dermal ablation, then pulse, pulse to establish the ablation. Overlap 50%, push, pulse, and then pulse, pulse. We keep doing rows like that, push, pulse, 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 overlap 50%, push. We're a little bit into the skin now. We've got silicone adjacent the epidermal dermal junction, so we're not getting a thermal disruption. We pulse to set it deep. Now that we're deep, pulse, pulse. Overlap 50%, push, set, pulse, pulse. Overlap 50%, set, pulse, pulse, pulse. Overlap 50%, set, pulse, pulse. And overlap 50%, push and set, pulse, pulse. Again, overlap 50%, push, pulse to get down to the 3,000 micron depth. We've spared the epidermal dermal surface, pulse, pulse. Overlap 50%, push. Now we're into the skin. The two negative electrodes act as a tension loading stretching mechanism. We pulse once to set deeply and then pulse twice to create the deep ablation. Overlap 50% and pulse, pulse. Now if we zoom in very tightly on that skin, you can see there's very little evidence of any crater because we haven't created a superficial epidermal ablation. This is a deep reticulodermal thermal stimulation because each one of these needles is silicone coated in the proximal 80%. Okay? This is pure tissue tightening, texture improvement, and deep rooted reduction. Push, set the depth with a pulse, and then pulse, pulse. Again, overlap 50%, push, set the depth, pulse, pulse. Overlap 50%, push, set the depth, and pulse, pulse. Overlap 50% and pulse, pulse. Okay, now you can come adjacent the nasolabial fold and treat under the eyes, which is excellent. So we're going to come up the nasolabial fold, overlap 50% this way and that way, so no negative electrodes ever get double treatment. Push, set the depth, pulse, pulse. Overlap, push, set the depth, and pulse, pulse. Now, as we're coming across the malar eminence and high cheek temporal area, same thing. Stretch the skin, push. You're now penetrating the epidermal dermal junction. You have silicone adjacent the epidermal superficial papillary dermis. Pulse once. Now it's down deep. You feel a little impulse as the needles go deeper, and then pulse, pulse. Overlap 50%. You can see the negative electrodes imprint on the skin. If you zoom in on that, you should be able to see that. Negative electrodes, we're overlapping 50% now. Push, pulse, pulse, pulse. Overlap 50%, push, pulse. Now we're down deep, pulse, pulse. And you can come right across the malar eminence with this technique. Right over the malar eminence, push, pulse, pulse, pulse. Stretch, right over the malar eminence, push, pulse, pulse, pulse. Again, you'd want to probably use the chiller for optimal discomfort control with this technique. Interestingly, well, not so interestingly, but physiologically, these 3,000 micron 24 pin tips are less painful than the 126 or the 60 pin tip. And why would that be? Well, first of all, they're lower density, so there's less total energy delivered to the skin. But also, these pins are very deep. And the depth means there's less superficial Paxinian corpuscles and Meissner sensory receptors, and it's not as sensitive deep as it is superficially. The silicone coating, there's no thermal stimulation of those superficial sensory receptors, so it's less uncomfortable than deeper treatment. Now, as we get close to the lower lid, I simply take my negative electrode and put that adjacent to the ciliary lash line. the negative electrode adjacent to the ciliary lash line. And estheticians, my nurses, your PAs, you can do this very safely without an internal shield or worry about optical injury. So simply have the patient open their eyes, look way up. That's perfect. We're going to come across the lower lid now. Push, pulse, pulse. Now you may see facial nerve stimulation with the Fractora, which is common. Don't worry about that. It's not pain. It's simply contraction of the deep facial nerve with the deep RF stimulation that this delivers. And push and pulse. This is a very deep applicator in the lower lid, 3,000 microns. We'll take it right below the orbicularis oculi or to the orbicularis oculi. There's even some fat pad improvement in the lower lid. It's not deep enough, however, to cause loss of fat in the mid-face or jawline area where we want to preserve facial volume. Look way up in the air. Again, I'm taking that electrode right up to the ciliary lash line. Push, pulse to get down deep, and then pulse, pulse. That initial contraction was not pain as much as orbicularis oculi contracting. Overlap 50% again. Push. I'm right up to the ciliary lash line now. Push, pulse to get down deep, little orbicularis oculi contraction, pulse, pulse. Overlap 50%, push, pulse to get down deep, and pulse, pulse. So if we look at the entire face now, and we look into the camera there, you see a tremendous amount of facial edema. Tremendous amount of edema. That is the tissue tightening effect of a silicone-coated effect. You don't see almost any ablative craters, very little superficial edema. This is deep tissue tightening edema with a silicone-coated tip, very powerful. We're going to complete now along the chin area here, overlap 50%, push, pulse, pulse, push, pulse to set, and pulse, pulse. Overlap 50%, push, pulse to set, pulse, pulse. 50%, push, pulse to set, pulse, pulse. A little bit of heme from the mechanical penetration, a little bit of blood, push, pulse to set, pulse, pulse. And again, overlap 50%, push, pulse to set, pulse, pulse. Overlap 50%, push, pulse, and pulse, pulse. Push, pulse, pulse, pulse. Now when doing the lip line, be careful if they have cosmetic tattooing of the upper lip. Take your negative electrode, make it adjacent to the white roll, and again, we're going to push, set, and there's a little peri-oral stimulation of orbicularis oris this time. Pulse, pulse. Overlap 50%, right down to the white roll, push, set, pulse, pulse. Overlap 50%, push, set, and then pulse, pulse. Push to set, push, and set. Pulse, pulse. Okay? Now what about the upper lid? Often there is laxity, there are wrinkles, there are issues on the upper lid. This is a great applicator, both the 3000 and then the 60 and the 126 pin. Need to be careful if you're going to use the 3000 upper and lower lid on very thin skin, particularly Caucasian skin type 1, 2, 3. The 3000 micron will get deep enough to get the deep reticular veins. You'll get a lot of ecchymosis and bruising around the eye, so warn patients. Good for tightening, good for lower lid bleph type effects with the 3000 coated, but you can get some ecchymosis. So you simply lift the brow up to expose that flesh over the orbital rim, overlap 50%, push to engage, set, and then pulse, pulse. You can see the orbicularis oculi stimulation. And again, overlap 50%, set, pulse, pulse. Overlap 50%, push, set, pulse, pulse. Overlap 50%, push, set, pulse, pulse. Again, a nice upper lid rejuvenation opportunity without the risk of optical ocular injury. Push, set, pulse, pulse. And again, orbicularis oculi stimulation. Again, my negative electrodes are lined up with the tarsal plate. Push, set, and pulse, pulse. Orbicularis oculi stimulation. For brow elevation, it's very good as well. You'll try to get tightening, tissue tightening of the brow. We're going to come up the temple here. Push, set, pulse, pulse. Overlap 50%. Push, set, pulse, pulse. Overlap 50%. Push, set, pulse, pulse. Overlap 50%. Push, set, pulse, pulse. Now once I get to the brow, I generally line up my negative electrode with the ciliary line. You don't want to get some electrolysis of the eyebrow hair, and so stay just north of it. Push, set, and pulse, pulse. Orbicularis oculi stimulation, a little bit of frontalis. Overlap 50%. Entry, set, pulse. 50%, set, get deep, pulse, pulse. And again, push, set, pulse, pulse. Overlap 50% both horizontally and vertically, so you never have electrode tracks overlapping. Push and set, then pulse, pulse. Push, set, pulse, pulse. Overlap, push, set, pulse, pulse. And overlap, push, set, pulse, pulse. Push, set, pulse, pulse. And push, set, pulse, pulse. Set, pulse, pulse. And overlap 50%, push, set, pulse, pulse. And push, set, pulse, pulse. Push, set, pulse, pulse. Set and pulse, pulse. Set, pulse, pulse. Set, pulse, pulse. Set, pulse, pulse. Set, pulse, pulse. And set, pulse, pulse. When you go a little faster, you can see some of that pinpoint bleeding I was talking about. Because this is a silicone-coated proximal needle, you don't get the coagulation of the dermis, and you can get some superficial bleeding. So I always carry a little gauze on my other hand. Even if I have the chiller in my hand, I just dab as I go. When you're going slower, you dab as you go, and you don't tend to get the pinpoint bleeding. We'll see on the contralateral side, where I use the unsilicone-coated tip, you rarely get this issue. Push, set, pulse, pulse. 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 And push, set, pulse, pulse. Now with this particular applicator, because there is no pulse limitation, this takes about 250 pulses to a full face pass, half face, 250 pulses. So if we look at her face now, half treated, you can see the effect on the brow. You can see the effect there on the brow, on the cheek, on the jawline, the swelling and the edema that will lead to her elevation and tightening and texture improvement, comparing one side to the other. Now, if you want more tightening, if you go side to side, go up and down on the second pass. If you went up and down on the brow, go side to side. 2 passes, sometimes 3 passes, and in areas where there are deep rhytids, I'll do a second, third, and fourth pass on the lower lid, along the nasolabial fold, or up the cheek and jawline. So you can simply come to areas where you want more tightening and do a second pass. Let's say we want to enhance that cheek and jawline elevation, and I went side to side before. You can go up and down after. We did side to side, we're going to go up and down this time. So you can do a second pass, set, pulse, pulse, overlapping 50% again, pulse, pulse. And this treatment, again, 250 pulses to do a half face, 500 pulses for a good face. If you had a pulse counter that cut you off like some systems, you'd be done. But you can do 1,000 passes and do a 2 face tissue tightening treatment. And the whole thing can be done easily in about 15 minutes. So very powerful tissue tightening tool. Very effective for getting tissue tightening in individuals that have laxity, texture improvement, acne scarring, and deep line and wrinkle management. Of course, if they have superficial problems as well, we're going to pull out another applicator and do a second pass. So I will do multiple 3,000 micron coated or uncoated passes, and then I'll take out a superficial applicator right over top to get superficial enhancement and dermal enhancement opportunities on top of the 3,000 micron. So there's a second pass on the cheek. If there are lower lid issues, which there often are, you can simply do a second pass of the lower lid, set, 2 pulses, overlap 50%, set, 2 passes, a pulse to set and 2 pulses, overlap 50%, push, set, 2 pulses. So very good for second pass tightening opportunities to create the type of tissue tightening that you really can't get with any other device that I know of. Now, just to show the different clinical effect, you can see very, very little epidermal effect on that tissue. We're going to switch now to another tip. This tip is also 3,000 microns, but it has no silicone coating. And we'll see a different epidermal-dermal effect with this particular tip. So here is our applicator. You simply switch tips. Again, positive to negative. Insert down your handpiece, snap in place, and you're ready to go. So we're going to do a 3,000 micron treatment without silicone coating. I'm going to turn the face here. You doing okay there, young lady? Mm-hmm. Now you've done a lot of different laser treatments. Was that acceptable?
Yes, that was.
Okay, well let's take a look. See the tail of her brow? The tail of the brow has a nice elevation and tightening. The under eye is tight. She's got a very strong tissue tightening treatment effect through the cheek, along the jawline. Very nice. Now, almost no, if you zoom in, there's almost no crater. You don't see a crater, you don't see any edema. Come up to the lower lid, very similar. Now look at the brow. We're going to compare that now with a 3,000 micron uncoated clinical effect. So we're going to come over here, and I'm going to put a little bit of gauze down here on your robe. Okay, and turn to the side. We'll do exactly the same thing on the contralateral side. Okay. Looks like there was a little IPL injury here, probably from another center, I would imagine. Hopefully not mine. And here we go, 3,000 micron uncoated, similar technique. In my other hand, I'd be holding the chiller, and I'd have a little bit of gauze and a chiller. I can dab and chill in advance of my, my applicator. There's another webinar you should watch on the Fractora resurfacing where I've done some blocks, some infiltrative anesthesia, because we're at 40 millijoules per pin. At 60, plus a second pass with a 60 or 126 pin. I'll often use anesthesia when we're at 60 millijoules per pin. And I'll show the chiller Fractora technique, double hand technique on that webinar. Okay, again, we're going to come by the ear, do your first pulses way out to the side, make sure it's tolerable, come along the jawline. This time you don't need to set because it coagulates all the way down through the skin. So you're just pressing, stretching the skin, and fire. You get a lot more stimulation with this one because it's also more superficial. Press and fire, press and fire, and again press and fire. And in this particular, you're going to see a lot more epidermal or dermal ablative effect. We're still overlapping 50%. You're overlapping 50% each time you move. You want to make sure that you're not exactly overlapping those negative electrodes, or you're going to get a little line mark. Okay, so 50% overlap. Again, pulse, overlap, 50%. A little bit faster the uncoated because you're using ablation right down through the epidermal-dermal junction. You can feel the product going into the skin as it ablates. You can feel the device going into the skin. We're overlapping about 50%. I've got the skin on a little bit of stretch. Okay, now we'll overlap 50% this way and that way. Little facial nerve stimulation, stretch the skin, press. You're still pressing firm and allowing it to ablate its way in. ablate its way in and down to the depth of the deep reticular dermis. You're creating epidermal dermal disruption as well as deep dermal ablation. So this will give you superficial texture and ablation completely all the way down. Okay, and we'll see a different clinical effect in a second when we allow some edema and some swelling around those ablative craters, because there is going to be some superficial ablation with this particular product because there's no silicone coating. Again, doing very well. But put the tissue on stretch, overlapping 50% each time. Get my hand out of the way so everybody can see. There's a much stronger smell of tissue ablation. You'll sometimes see smoke actually coming up as you're ablated human tissue with the uncoated. That's the clinical effect. Again, you can do multiple passes with this. It takes about 250 pulses or so to do a hemi-face, and I'll usually come back and do a second, third, fourth, and fifth, even a sixth pass when we've got aurited areas or laxity areas. Remember, this is only 24 pins. The density of epidermal dermal destruction is very low, less than 5%. So you can easily come back and do 2, 3, 4, and 5 passes without destroying the fractional concept of the ablation. So I put a little bit of pressure on the skin and then let the RF ablate down deep. Put a little pressure on the skin, let the RF do the ablation, and take it down deep. Little pressure, stretch the skin, ablate. Little pressure, stretch the skin, ablate. Who would use the uncoated on? All skin types 1, 2, and 3 and light 4s who've been pre-prepped with some bleaching that want superficial and deep ablation. Individuals that don't mind a few more days off, because this does leave a little bit more edema and swelling because of the ablation. And it's also fairly quick treatment. As you can see, we've done the whole face in about a couple of minutes, even with me talking. I'm overlapping 50% every time. Now, when we come back, we're going to look at that in a second. We're going to see a lot more edema and swelling on that side around each of our ablative craters. Now we're going to do the lower lid. Have the patient look up, and we're going to take that negative electrode up to the eye, and we get a little orbicularis oculi contraction, more than silicone coated, because there's more superficial stimulation. Overlap 50%, and again, pulse, overlap 50%, and pulse, overlap 50%, and pulse. And again, let's do a second pass, especially in the lower lid. Don't be afraid with this tip to do 4 or 5 passes to get optimal rejuvenation, okay? Don't be afraid to do 4 or 5 passes. I'm overlapping 50% each time, okay? There's 4 passes. Now, coming up the forehead, we'll do the same thing. We're going to tighten the temporal area. Good for acne scars and texture in the temporal hollow. Can you do this over injection products? As long as you don't have intradermal injections, you can do any of these bipolar Fractora tips because they stay within the dermal integument. There is no deep RF like monopolar might give, and there's no degeneration of your radius, your calcium hydroxyapatite, your polygalactic acid, Sculptra, your hyaluronic acid sugar gels, Voluma, Ultra Plus, Refine, Restylane, Perlane. Any of those products will be safe as long as you've injected in the deep sub-Q and periosteal space. You'll be safe. I'm overlapping about 50% here. Again, a bit faster treatment without the silicone coating because you don't really have to set, you don't have to double pulse. Very simple little product to use, and in about 250 pulses, we will do the hemi-face quite easily. And we are going to now come along the chin point here and do the chin point. And again, we're getting some nice ablation into the skin, overlapping 50%. And some rejuvenation. Again with the upper lip, put your negative electrode down by the white roll and let the device ablate into the tissue, ablate into the tissue, and ablate into the tissue. Because of the 3,000 micron depth of this needle, a lot of the vascular tone gets reduced. Superficial dermal telangiectasias will often get partially coagulated with this effect. So unlike CO2 or fractional opticals, chin up just a bit. This will deliver a very nice improvement in the overall vascular tone. You may still combine with IPL, but still a very nice improvement can be achieved. We're going to come along the nasal sidewall now. Simply press firmly. I've got my electrodes lined up vertically. Firmly along the nasal sidewall. Pulse, overlap 50%. Pulse. This will be good for pores, for sebaceous hyperplasia, for texture on the nose. We can go to the contralateral side. Again, I put my finger on the other side. Center that. Perfect. I push against my finger and go up the sidewall. Overlap 50%. Up the sidewall. Now, you don't need to have all the negative and positive electrodes intact when you're coming along the bridge. As long as there is negative and positive electrodes, the RF will flow. The power density may be a little different, but I'm talking about the bridge. Line up your electrodes horizontally, negative electrodes. So now you have positive, negative electrode return. And simply pulse up the bridge, overlapping 50%. Pulse up the bridge, overlapping 50%. Up the bridge, pulsing 50%. And then turn and treat the glabella. Okay, very simple nasal treatment. Now, if you want to get some more jawline tightening, of course, chin up just a bit, we can do a little bit more on the jawline. If I went horizontally before, I'll go vertically. Again, pulse, overlapping 50%. Very nice little treatment. You can see some of the smoke from the epidermal ablation. We certainly didn't see that on the silicone-coated side because there was no epidermal ablation. We were using a mechanical epidermal dermal penetration technique and then allowing the RF to get the set the tip of the needles down to the 3,000 micron depth. And between 2,000 and 3,000 microns, we're getting an ablation. But there was no superficial epidermal thermal stimulation, hence no plume. Again, a very, very effective tool, the silicone and uncoated silicone and uncoated non-silicone 3,000 micron tip. One of the best fractional tissue tighteners you're going to see out there with a very nice thermal effect. We're going to finish off with a little tightening across her cheek, doing a second pass. We've already done one. And you can see how quick this treatment would be with adequate anesthesia. We're using very strong energies, 40 millijoules per pin. Patient's quite tolerable because A, it's the 3,000 micron tip, so it's deeper. There's less superficial stimulation than a more superficial tip. And so if we compare the two sides in a second, we'll see the difference between thermal ablation and non-ablation. If we look at this, if we zoom in just here, you can see the edematous, swollen, ablative areas of the skin that are generated by the 3,000 micron uncoated. On the contralateral side, relatively smooth compared to the other side because there's no thermal epidermal disruption. Now if we, again, I'm just going to do a little bit more here on the forehead because that's an area where some lifting and tightening may want to occur. And we've got to just finish with her upper lid and then we are completed our 3,000 micron pass. Now, that may be the only fractional Fractora treatment we do, or we may want to combine a more superficial effect, again, for that designer dermis. And again, lift your eye up with your, the brow up with your hand. Place the negative electrode down towards the tarsal plate. And again, you can ablate across that. Again, with the 3,000 micron needle, you may get some superficial veins, so bruising a little more common when you're using this technique. And so put a little bit of pressure on any of those superficial vessels, even with the coagulation of this particular applicator, okay? So I'm going to hold a little bit of pressure there. And when we come back, I'm going to change this tip to a 60 pin 600 micron, and we'll complete our designer dermis by a more superficial pass. One of the very powerful, multifaceted aspects of the Fractora resurfacing product, the standalone total tissue tightening texture wrinkle reduction tool, is the ability to design that dermal effect. You've seen the 3,000 micron silicone coated that spares the epidermal dermal thermal effect with a deep dermal tissue ablation and tightening. You can uncoat it and have superficial mid to really transdermal tightening with a superficial low density ablation with multiple passes. You can use the silicone coated stay deep and then come right over top with a very mid to high density effect with your 60 pin or 126 pin, both being 600 microns deep. So here we have the 3,000 micron product, okay? And we've done the treatment, coated and uncoated. We can simply remove the 3000 micron coated or uncoated product, which gave us deep tissue tightening and some epidermal impact if it's uncoated. We can remove that, and we've done up to 1,000 pulses with 2, 3, 4, and 5 passes on areas of the face. And we have a couple of options if there's a lot of superficial injury on that skin. We can take these two types of tips. We've got the 60 pin, 600 micron, and that would be medium density. For moderate lines, moderate photo aging and damage, a medium density, 15% coverage, a 60 pin tip. Each is about 100 to 120 microns in width, and they're 600 microns deep, and you can see what it looks like and the side view of the depth. The other option, if you've got very, very diffuse superficial damage, is the 126 pin, and you can see the difference in the density. High density, low density impact. None of these are silicone coated, so there's going to be epidermal dermal impact as well as deep dermal ablative, and then the sublative, non-ablative RF that flows to the negative electrodes. And you can see these are also 600 microns deep, but high density. So for photo aging people with laxity, I tend to use this combined with the 3000 micron. So a nice double treatment, tightening, texture and wrinkles, superficial rhytids, and photo aging. For intermediate rhytid pathology with laxity, you can simply take your 60 pin tip combined with your 3000 for, again, a designer dermis that results in medium density superficial line and wrinkle improvement combined with your 3000 micron tissue tightener. Again, a very powerful product. No other resurfacing optical or non-optical technique allows you to differentiate and create those unique opportunities within the dermal space. So let's go over our patient today with the 60 pin 600 micron. You simply plug this in, positive to negative. There's the negative electrode receptacle, and you plug that in, male to female, and make sure it goes right in and seats nicely inside that product so it's ready to use. We're going to go back to our machine now, and we're going to look at our machine. And of course, we have to go to the menu. I'll leave it at 1 pulse per second. 30 to 40 millijoules per pin. In the hands of your esthetician, again, this is nice because it's a delegable act product. You may not feel comfortable delegating your fractional CO2 to your estheticians and medical assistants and nurses and PAs, but you certainly can with this RF system. Generally under 30 millijoules per pin for delegation professionals, over 30 for medical professionals. And we want to move up to now the 60 pin. We simply go to the menu, the up and down dials, and we hit 60 pin. You can do 126 pin if you want, back down to 60, or to the 24 or the 20. If you're happy with the 60 pin, you hit the check mark, and we are ready to go. Okay, so we're going to go back to our patient now. This is foot pedal activated, and we'll do our treatment. So our patient's doing reasonably comfortable. She said it was a fairly comfortable treatment with the lower density 24 pin deep treatment. Now she's got a bit of acne scarring here. Zoom in a bit. Little acne scarring in the chin and acne scarring in the cheek. For patients with rhytids under the eyes or perioral, we would use our 60 pin, 600 micron, or the 126 pin high density to do more superficial treatments. Very simple little technique, again, 1 pulse per second. I'm going to start over the side here so she gets a feeling and lets me know if this is acceptable to her. And I'll just turn that down, as I said, to 30 millijoules per pin. And we press ready, and we're ready to go. And we'll do a little treatment here on the side. 1, 2, and 3. Is that acceptable? Once it's acceptable, and I've done a little bit to the lateral, again, facial nerve stimulation because it's more superficial. Put the skin on stretch. Use a second hand to use the cooler. A little bit of light to moderate pressure. You don't need to press terribly hard with this product because it ablates its way into the tissue. And this is for superficial improvement right over top of where we did very deep improvement. The ability to design and layer that ablative and sublative effect makes this a very powerful tool. This has evolved to be an interesting leading tissue tightening, texture reduction, fractional platform. Far more versatile than any other more limited optical fractional platforms and RF platforms currently available. Again, very quickly you can do the whole face. Very, very important with these more superficial devices where a lot of RF current is flowing superficially through the tissue. If you look, for example, here I pulse, I make sure I overlap 50%. Do not risk overlapping those negative electrodes. If when I lifted and I moved, and that a negative electrode overlapped exactly where the previous negative electrode was, if I have a double pulse right along one of these negative electrodes, that's a lot of positive RF current flowing to there, you're going to get a stripe of complete epidermal ablation. It will heal, but they'll heal with a number of red lines or stripes, tiger striping, on their face. It'll be fine, but those areas are not fractional because you've taken the entire epidermal-dermal junction off. So overlap more than you think, overlap 50%. Because this is such a fast tool, and we can do the entire face very quickly, turn the negative electrodes up towards the eyelid, again up towards the eyelid, open the eye, and you can come right under the eye, get some nice wrinkle reduction. If they have rhytids there, you can come back and do a second pass and take this from 15% coverage to 30% coverage very quickly. And there's our superficial pass, very easy to do. Very quick, right over top of where our 3,000 pin treatment went with this 60 pin 600 micron. You can see, if you zoom in on that, there's some charred tissue, ablative tissue. When you're at energies 30 millijoules or above, you're not able to use this a second or third time. At more modest levels, let's say in the esthetician's hands where they might be doing 15, 20 millijoules per pin and they bring the patient back every week or 2 weeks for a series of 5 to 8 treatments, yes, you can get up to 3 treatments by putting this in a baggie, giving it to the patient. But in physician's energies, there's so much charred tissue you need to throw these out after. And you certainly can't use it on another patient, of course. Turn this way, and again the same thing. We're going to do some superficial treatments here on this young lady to get texture and line improvement. Start laterally and pulse. You can sometimes see a facial nerve effect like there. Overlap 50% each time. Now with the chiller and topical, this will be very acceptable at this energy level. If you're going to do much higher energy levels, you want to make sure you're using nerve blocks or infiltrative regional anesthesia, what I call hypodermal wetting technique. And there's another webinar where I show this, so if you want to know how to make these treatments very effective and comfortable, if you're a physician or a Delegal Black professional and you want to have one treatment results with higher energies, simply watch the webinar on high fluence regional anesthetic Fractora resurfacing, which will show you what works for me. Again, I'm overlapping 50%. If you notice, I don't overlap that far, or there's going to be 2 adjacent negative electrodes touching. I go from here and overlap about 50%. Because it's such a big applicator, overlapping that much doesn't compromise in your speed at all, and it ensures that you get total surface coverage and you don't get any tiger striping. Now, when using the superficial applicators like the 126 pin or the 60 pin on the forehead, very important that in principle, whatever you do on the face, turn down the energy by about 10 millijoules per pin and maybe do a second pass, because the forehead is very thin tissue and it's very easy to get striping if you're not cognizant of overlapping excessively, like 50% or more. No 2 negative electrodes should be in contact synchronously in two synchronous pulses, and you should not have to worry about getting lines. Again, turn the negative electrodes up towards the ciliary lash line, and you can come right around the lower lid and get some nice texture tissue improvements in those individuals with fine lines and wrinkles. The more superficial tips are very good for treating the upper lid tissue. Simply by lifting, you can get nice upper lid ablation for fine lines and wrinkles. On the forehead, I would turn down about 10 millijoules per pin on the forehead, specifically on the forehead, and we would ensure we overlap 50%. Very much overlap on the forehead so you don't get any striping. And you might turn down by about 10 millijoules per pin, whatever you're doing on the face, and maybe do 2 or 3 passes. So turn down the energy, overlap a lot, and you will not get any tiger striping on the forehead. Now we're going to go to the contralateral area of the forehead and do the same thing. Again, superficial ablation, overlapping about 50% at least. You've turned down the energy when you're first starting out. If you noticed, I'm not turning down the energy. I think if you overlap very carefully, you will not get that synchronous overlap negative electrode, and you'll run out of, you will not run that risk. Remember that the actual electrodes is a relatively small surface area, so you need to really overlap a lot in order for those negative electrodes not to touch each other on two synchronous pulses. And as you can see, no strip electrode injuries here on the forehead. And we've able to do a very quick little treatment with superficial texture improvement on this young lady on the same areas where we have done already the 3000 micron tip. The last area is a little bit of acne scarring in this little parasymphyseal region of her left lower chin and jawline area. And then of course these applicators are very effective in combination with the 3000, the 60 pin like this one, and the 126 when treating rhytids of the upper lip. So the same concept, the negative electrode moves down onto the white roll, and you would cool the lip with a chiller. Once it's cool, fire. Cool the lip with a chiller. Once it's cool, and fire. You're going to overlap 50%, and you may do 2 or 3 passes, just like you might do 5 or 6 passes with a 3000 micron tip. Do 2 or 3 passes on rhytids and wrinkles to get a very nice improvement. With the combination of the 3000 and either the 60 or the 126 pin, at the end of the treatment you want to see enough edema where you don't see those lines and wrinkles, and then you'll get a tremendous improvement. Again, you can use the same superficial medium or high density on the nose, press and fire and come up the nasal sidewall, and again down on the bridge. Unlimited number of pulses, no pulse counter that regulates when you have to stop using this product. Okay, so we have done a total face double applicator Fractora tissue tightening texture and wrinkle reduction treatment. Now if we look at this young lady now in the actual camera, open your eyes there. Okay. There we go, a little eyelash. Okay, looking at, you can see there's a lot of edema, but she actually looks reasonably good. Now she ain't going back to work today, so this is not a return to work immediately. This is the type of thing you would do, and maybe she'd go back to work tomorrow with a little swelling, or do it on a Friday, be back to work on a Monday. If I was up around 60 millijoules per pin for each applicator, of course she would take a few days off work. You can combine this with fillers, with injectables, and I'll talk about that during the FIRM webinar. So if you're interested in seeing combination therapy, watch the Fractora FIRM webinar, which is the non-ablative thermally monitored applicator. But again, very, very powerful tool, the Fractora. So the Fractora really has evolved to be the most versatile fractional resurfacing tool that I use in my practice. I use it on the base of the neck during facelifts or during closed rejuvenation, 3000 micron, coated, uncoated. I'll come over top with a 60 or 126 pin depending on how diffuse the superficial damage is. As you can see from Dr. Lask, from myself, from Dr. Loeb, from other European experts, the Fractora as a standalone has become one of the most important aesthetic products, I think, in a practice. It really combines what you might get from an E-Prime, Primeva, an Ulthera, with non-ablative RF tightening like a Thermage or other stamping technologies, and a CO2 or erbium type effect, all wrapped into one opportunity. It's appealing because it's delegable safely to estheticians, medical assistants, or PAs, nurses, and it's useful to give me unique physician tightening, wrinkle reduction, and texture opportunities. So I hope that you find the Fractora resurfacing product to be a total tissue rejuvenation anti-aging, a platform that you can combine with your neuromodulator and your filler practice to deliver some pretty amazing results. Thank you very much for watching this webinar. And if you're interested in non-ablative RF thermally modulated tighteners, watch the FIRM webinar. And of course, the updated Tight Effects, permanent fat reduction, skin tightening, and cellulite enhancement webinar. Thank you very much, and happy profits.
Well, Ruth wanted to look as good as she felt. Dr. Mulholland suggested Fractora, and the results were incredible. Take a look.
I'm a busy professional. I'm a single mom with 3 kids. My life is crazy active. Well, I don't really think that I've done a good job taking care of my skin as far as protecting it from the sun. I do have some sun damage. It's probably accelerated the aging process a little bit.
Ruth is really the prototypical patient for this type of program. She's in her 40s and her 50s. In her younger years, she enjoyed the sunshine. Maybe people smoked. They gained weight, lost weight, maybe had kids, job stress. And suddenly they wake up one day, they look in the mirror and go, oh my goodness, who is this? I feel young, I'm working out and exercising, but all those years have added up to lines and wrinkles, deflation and descent. Ruth's specific procedure on each visit would consist of the Fractora device, the electrical current needling device that created the little microscopic holes going down into the skin. That in itself creates new collagen and elastin, but we take advantage of the actual conduit, the pore that we've created, right into the deep skin to put on the SkinCeutical product that permeates the skin with a whole bunch of bioactive chemicals, again augmenting and synergizing and amplifying that new collagen, new elastin, new ground substance.
I'm feeling amazing actually, really happy with the results. I think that it's brought sort of a restorative look to my skin and I feel really good about how it looks. I think I've achieved that youthful glow that I was hoping to get. And I'm really happy.
Like a whole new woman. Let's go to break. It's Makeover Madness. Stay with us. More coming up. On today's City Line, it's Makeover Madness. Well, what in the world is going on? There are men everywhere who all of a sudden want to look as good as us ladies want to look. I don't know if it's the media, I don't know if it's us putting the pressure on them. We've got Dr. Stephen Mulholland here and Dr. Jordan Saul, Aesthetics and Dentistry, Spa Medica, to talk to us about this new phenomenon. So, of course, you know, I went to the only person I could in the audience, this poor gentleman in the back in the stripes. Give us a wave, hi, because I was grilling him before the show. So, you've never wanted anything done ever? No. He's like, no, I'm pretty happy with myself. But there is this new breed of guy who is out there and is interested in cosmetic procedures. So tell me a little bit about that. What are you seeing more of that in your client base?
There's no question about it. When I started in 1995, 96, I saw one guy the entire year.
Okay.
One guy. This past year, fully 10% of all cosmetic procedures. So about 100,000 men in Canada get some type of physical cosmetic enhancement.
What are they getting done?
Well, you divide it into surgical, non-surgical. Non-surgical would be Botox, soft tissue fillers, hair removal in unwanted areas, hair restoration in desired areas. Those are the top things men do. And then surgically, they get the bags treated, the double chin treated, the 50-year-old male boobie treated, and then love handles. Those are the top 5 things that guys get.
So no breast augmentation then?
That would be making them smaller, yes.
Making them smaller, not bigger. Okay, so let's take a look at Carl, who came into Dr. Mulholland's office for some anti-aging procedures.
When you look in the mirror, what are the top 3 things that bug you? What's bugging you?
The pouches under the eyes.
So pouches under the eyes.
Tired look half the time, even when I feel energetic, you know, and this stuff here, the little lines.
There's still very much in culture, in our Western culture, a taboo or some type of stigmatization of males having cosmetic procedures. For men, it's still very much a closet thing.
I already put a lot of focus into, you know, yoga, eating well, exercising, all of that, and I wanted my face to reflect that.
What we did with Carl was a very common constellation of treatments that I do with guys. First of all, make the skin look even and clean. For most guys, skincare is like Irish Spring. And so we had to bring him into, how to look after the skin. So we did photofacials, which evened up the broken capillaries and the redness. Then we evened out his pores and his texture. We used Botox in areas where he was looking very worried and angry in his forehead. Very simple guy makeover.
It's been a nice, subtle change, where essentially you're just winding the clock back a little bit, but, essentially I look the same as I did before. It's just that I look the way I looked 5 years ago, 6, 7 years ago, as opposed to the way I looked 6 months ago.
Yep. Well, in a lot of cosmetic surgery, you find that subtle is the name of the game, right?
So true. Well, Carl's very much like most guys. They do it for what I call B&B, bedroom and boardroom. That's why they do it. They do it because they need to look good in their job, and they know that they are judged. The book's judged by its cover, and they're looking for a new relationship or getting out of an old relationship. The same motivations as women. We've just been less likely to admit it.
And yeah, more men are saying now you need this to stay in your job. You're not allowed to get old anymore, or to get that job, right? You've got to have a certain appearance. So I call it the George Clooney effect. Everybody wants to look like George. He's just a hot-looking guy. Do you approach men's faces a little bit differently than you would approach a woman's face?
Totally differently. In a man, you want to preserve the maleness of that look. So it's about a strong jawline, I can take you anytime looking jaw.
Ooh.
Not the Madonna lift or big feminine cheeks. And the goal is not to erase lines and wrinkles. In fact, to just allow the lines and wrinkles to help define and characterize them. So it's very subtle. And if you look at the results of well-done guy procedures, you don't think he's had a procedure. You say, wow, he's looking good. He's looking healthy, looking vibrant, fresh.
Okay, can we talk a little bit quickly before we talk about teeth? Botox and Juvederm, what are the effects of each one?
Botox softens really strong muscles. For example, Carl made a comment that his wife always misinterpreted that he was angry. He was angry at her. And when she saw him with the Botox just in his frown area, she said, wow, for 10 years I've always thought you were irritated. You just move a lot. And so Botox softens movement, and Juvederm is one of the more common fillers, so it adds fullness. I enhanced his jawline so he looked more Clint Eastwood, Newt Rockney-ish. Yeah.
Very cool.
Come on in, Stephen, and we'll get all prepared for your procedure today. So we're going to contour the belt line, the chest. That'll make a big difference in your clothing and your bathing wear. And about 2 weeks from now, you're going to be in tight shirts and on the beach.
At 61 years old, I exercise daily, but I have limitations because of knee surgery. I eat sensibly. It's not my diet and everything that's making me store fat cells or whatever, but it's not going away.
Stephen represents a typical body contour patient. He's got flabby fat. It's loose, and if we don't tighten it, he shouldn't do liposuction because it would look worse. We've got to tighten skin and reduce the fat. We put a device under the skin and into the fat under some IV sedation or just local anesthesia, and that device heats the fat, melts it, then we remove the liquefied fat. Stephen's results are very typical. He notices within a few weeks a tremendous change in his contour, flattening of the chest contour, tightening of the chest skin, tightening of the tummy skin, and improvements in his love handles. So contour correction, skin tightening.
I am feeling very good. I felt very good from probably the second, third day. I'm very, very pleased with the results, and hopefully it'll last for a long time.
Wow, he should be pleased. Good work. So what are the main areas where men are holding their fatty deposits?
Well, men and women. I'm seeing older individuals, now older meaning that they're not 25 anymore. I'm seeing postpartum moms in their late 30s, early 40s, and guys who are older. And traditional liposuction, which removes the fat, the skin can sometimes sag and not look great. So there's a whole host of new technologies like this Body Tight that emits electrical energy that heats the skin and tightens it while you remove the fat, so it matches the skin tone to the fat removal. And so for guys, it's the chest, double chin, love handles, and the Molson muscle.
Yes.
For women, it's usually the hips, the pot, the outer inner thighs.
Yes. Tell
And
me
so
about
these body type technologies really allow people with compromised skin tone to get contouring without the big incisions, without the tummy tucks and the body lifts and the thigh lifts. So like Stephen, he can be back to his activities within a couple days.
Okay, so you mean this is not for someone who is obese. This is for someone who is very close to their goal body and they just need a little bit of help?
Exactly. So if someone comes in and they're just nowhere near their target weight or what they would feel comfortable at, weight loss, diet, exercise, always first.
Right.
And then something like this to polish off the contour, to put the frame on the canvas, but you have to create the canvas. This isn't a weight loss procedure.
Okay, very cool. Typical recovery time?
Well, you can be up and walking that afternoon, that next day, but back exercising, high impact aerobics takes 2 or 3 weeks.
You just jump off the table and go home?
Well, not quite jump. you ambulate
Just
cautiously.
checking. Very good, good information. So now, what are you going to go home and tell your husbands? Look, you can just, it's easy. Look at the guy, look great in the tape.
Number one referral source
Yeah.
is women and wives of the husband.
Of course.
They're looking good and they look in the mirror and say, honey, you ain't going out with me looking like that. And they drag them in by the ear to do something.
That, very cool. Thank you so much for that. We're going to go to break. Stay with us. Well, I think it's safe to say a lot of people want to look younger, but they don't necessarily like the idea of having cosmetic surgery. Diane is one of those people, so she went to Dr. Steve Mulholland for some other solutions.
Good, Dr. Mulholland's ready to see you. So bring you right in.
Diane Armstrong is a prototypical type of patient that I would see. She's a working woman. She's active in business. She's got an active social life. She feels young. She diets. She exercises. Despite all her efforts, she looks in the mirror and she goes, oh my goodness, who is that? Thankfully, nowadays we have so many options for these people to look great without a big operation.
I have all these little hereditary kind of lines that I think he calls them marionette lines here. They're not that deep, but you know, they're there, and I teach fitness classes and I'm in front of people for business as well. So those kinds of things I'm noticing more as the light shines on them. It's like, all right, and I don't really feel my age. So I'd like to see those things. I think it would just tighten it up and make you look a little more fresh and alive looking without having to have surgery.
Good to see you again, Diane. Good to see you.
How are you? Good. I'm
excited?
good. Yeah, I am excited.
Well, come on in. Let's chat a bit about our procedure today. Come on in and have a seat. Some of your concerns and issues about what you don't like are, number one, loosey-goosey skin under here.
Yes.
Some lines and wrinkles around the mouth, the cheek, and the brow.
Right.
And then as we've aged, we've lost a little bit of volume under the eyes and around the mouth, so we look a little sunken. And so we're going to address all of those today in this combination of non-invasive things. So, okay, Diane, come on in to our procedure room here, and I'll get you nice and comfortable. I'm going to slowly bring back the volume in your under eye that age has taken away. Okay, perfect. Now I'm going to compare both sides, make sure they're looking great. Look this way. I'm looking at the shape and the structure. I'm really happy with what we're bringing out. Things are looking great. Now we're going to go after granny mouth. So I'm going to position the laser now. We'll finish off with the Botox. It's going to look great. 5 years younger in 30 minutes.
I like it.
Diane was that typical example you hear about, you know, a woman who looks in the mirror and she's not seeing who she feels like, and she just sort of wants to get rid of some of those lines. What is amazing, and people are going to be in awe when you see the after photos, all of this was done without cutting. There was no cosmetic surgery involved. Walk us through exactly what you did. We saw the laser on her face.
Well, you're absolutely right. Many patients want to look great, but they don't want a knife-based experience. And we're in a wonderful age right now in plastic surgery enhancement where we don't need to do that. So she was an individual that I see many women like this each week, where we do about 45 minutes of treatment. You saw a little bit of laser. There's some needle-based treatments, some Botox, some new fillers that will last a couple of years, and then some skin tightening techniques. Rather than throwing away skin, just going under the skin and tightening it. Right. And all that can be done, as you can see, under local anesthetic without the risk of general. And then perhaps, you know, 2 or 3 days off and you're back into the fray.
So what I was asking you was, did any of that hurt? But she's frozen.
Yeah, so there's always discomfort. To say it's painless is usually not being honest with the patient. Yeah. The pain comes from having some anesthesia, so there's a little bit of local, like if you were at a dentist and they're freezing your gums, your teeth. But once the freezing's in, and that's a couple of minutes of discomfort, then there's really no pain.
Now, I can imagine a lot of women would be into having, you know, injections and laser treatment if it's going to make them look as good as Diane did and avoid sort of the really invasive surgery. But how long do these injections actually last? And talk to me a little bit about maintenance.
So in years gone by, we would do an injection. You'd have to come back every 3 months. That's not practical for a working woman, for any woman really who wants to keep going back. Now we have long-term solutions, injectable Voluma type products that will last for 2 years. We have Botox techniques that means you come in twice a year, and a lot of these laser techniques are good for years. So I sum it all up for most patients. If you don't want a facelift, and there's still some that do, but for those that don't, you can look about 5 years younger in less than an hour, and it's going to last you at least a year. And so let's say you buy a car, you have a house, you just kind of look after it. You do a little gardening, you put a little gas in the tank, so there's some maintenance, but it's very affordable maintenance, and to look 5 years younger in perpetuity is a very strong message for people.
Can we talk a little bit about price?
Yeah, so if you're going to go for the whole 5 years younger, you're looking between $3,000 and $4,500 in most practices. So I usually again say, well, it's less than $1,000 a year. So how much is a year? What value is it to you? And it's got to be affordable in this economy. It's got to be safe, effective, and last. Okay, so take a look at these shots right now that we have. We're showing a picture of the before and after of Diane. This is from the side. A huge difference here. This is the overall. You can see it mostly here in the eyes, though. Yeah, if you look at the overall picture, her skin is tighter, it's firmer. She's got appropriate volume, but she still looks natural. She doesn't look done. That's right. And many women are just afraid of looking at, like a character, like they see on the cover of Us, We, Now, Them, these horrible before and afters. She looks like herself, but at least 5 years younger. Now, I know that there was some work done as well on her in the jaw area. What did you do there? There's some very new devices that even if you don't have any fat, we can go under the skin, under local, like you did with Diane. It's called neck tight, and we can tighten the skin just by heating the undercarpet. So by heating the undercarpet, we induce a contraction, if you will, and look at the difference in her neck. Take a look at that. So you basically went in there with a very small incision. A very, like less than 3 millimeters. We didn't remove any skin. We just induced her skin to become younger and get more elastin and collagen. Yes. And so these types of neck tight, face tight procedures are very popular because there's no scalpel used. Right. Now, is there ever a time when you should not consider doing procedures like this, or is there an age that you're too young to start doing these procedures? I think... Like, should you start in your 30s? Should you wait till your 60s? Should you not be doing this in your 70s? Excellent question. So when is it age appropriate? Yeah. You know, everybody ages differently. We have hereditary issues. We have life and environmental issues. Yeah. As soon as you start to see signs of wrinkles or deflation, either grow old gloriously with that and celebrate it, or then you start to fight it. And when you start to fight it, simple things done a couple times a year, and you could look really 5 years to 8 years younger for the rest of your life. You really, I think we're entering a period where you don't need to do a scalpel or knife-based surgery to look great forever. And great to me is 5 to 8 years younger than your stated age. Yes. So if you're 55, you're always looking 48. If you're 65, you're looking 58. I like the sound of that. How old is Diane? Do you mind? Diane is in her mid-50s. She's about 56, and she looks a good 48, 49 when she emerged out of that. Yeah. Do you see a day when people will, you know, decide in the morning that they want to get some of these procedures done over the lunch hour and you know, get some laser done and have a sandwich and go back to work? It just seems to be so easy. You'd think that the entire procedure, it used to be a very big deal to get work that had that kind of impact. But to see her looking this good and knowing that she took maybe 2 or 3 days off afterwards, it almost seems conceivable that this sort of cosmetic enhancement can become
so easy, like a daytime thing.
I think a daytime is realistic. A lot of companies promote the lunchtime makeover.
Yeah.
You need to take the rest of the day off at least, and preferably a weekend.
Don't go back to work that day.
Unless we get something miraculous in the sandwich that turns back the clock, you still need to take some time off.
All right. When you do get these clients that are coming in, if someone were to come in and say, okay, I would like to get a facelift, is there ever a time when you say to them, you know what, you don't need to be that invasive. We can do the same things you want and use technology that is not going to be that invasive?
That's a great question. Usually when I meet someone, I ask them, are their goals to look their best? Are they interested in surgery or non-surgery? Almost everybody says, well, show me what non-surgery can do.
Yeah.
I show them in the mirror what we could do with these non-surgical techniques, show them some before and afters, and many patients will go, wow, I can do that without a facelift? I'm there.
Absolutely.
But there's some patients who, you know, if you leave it too long, if the car is too broken down, the house is too dilapidated, you need to renovate a little more intensively.
Yeah.
But the vast majority of patients I see now are between, say, 30 and 50. They're looking pretty good, and they just want to keep looking gooder. Without anything invasive.
Very interesting. We noticed as well, you might have noticed in some of the picture, her teeth actually changed a little bit as well. So we're going to take a break. When we come back, we're going to talk to Dr. Jordan Saul about her teeth. You've also sent us some goodies. Yes, the audience is very happy to hear about this. Dr. Mulholland has brought down optimal eye and lip makeup remover and a $100 off coupon from Spa Medica for everyone in the audience. Yeah, that's a good one. All right, going to break. We'll be right back.
Certainly, there were little points in there that were, I thought, oh my. But it was, overall, it was a great experience, both for the face and the teeth. It was wonderful. Hi, Dr. Mulholland.
Diane, it's so good to see you again.
Yeah, good to see you as well.
Have a seat. I've got some great pictures to show you.
Oh, lovely.
There's been a tremendous rejuvenation, both in the eye area and the jawline. You feel you look natural,
yes,
but relaxed
very
and
much.
refreshed.
Exactly.
Which was our goal.
But Steve, how does she feel about her after? I mean, the difference between the before and after is just amazing. How's she feeling about the whole thing? Look at that. That is amazing. Yeah. And you were saying some of these, this was like 45 minutes. It takes less than an hour to get that type of overall skin and face appearance. But again, if you look at the beautiful work that Jordan did, without the teeth, it was really missing that final component that's so important. And then hair and makeup. It all really comes together. Your whole show comes together in a synthesis of looking your best, really. Trust me, I know a thing or two about hair and makeup. I would not be doing this show without it. How long are the crowns and veneers going to last? And do they take some maintenance?
Well, the maintenance they take is good home care.
Okay.
And seeing your dental hygienist on a regular basis. And it's really your dentist that should decide what is the proper interval, whether you should be seen every 3 months, every 6 months. And so really, if you maintain them well, crowns should go anywhere from 5 to 25 years. Excellent. All right. Good work on both of your behalves. And I think that it's good information for people out there who are looking for an easy way to get a nice freshen up. So thanks for that. Makeover Magic.
Jennifer, I must say you're looking younger today.
Yes.
How old do you think I look?
Okay, no, loaded question. Don't even answer.
Yeah,
Don't. It's a trap, Frank.
Yeah, you look 20.
Don't even do that.
Hey,
it's a trap.
Thank you.
See?
My daughter knows how to answer that question. She will tell me I look 25. She will tell you I am 25.
Well, that's because you've told her you're 25. What are you doing today?
It's true. She's going to start to figure it out when she gets a little older and, you know.
When she's 25.
Maybe she's 27 and I'm still telling people I'm 25. We are spending the morning with Dr. Stephen Mulholland at Spa Medica. And we were talking about the latest and greatest in non-surgical procedures, including something called Voluma, which sort of shall I say, inflates your face when it deflates.
Oh.
After it's when you need a little, you know, need a little lift in your face. This is a non-surgical procedure. We're going to be showing it this morning on breakfast television. But you know what I always say, as you get a little older, you have to gain a little weight. That's good news for women because you want to have, you know, just a little bit more in your face.
All right,
so,
thank you, Jen. I look forward to that.
You know what happens to men when we gain too much weight?
No problem.
What's that?
We grow extra chins.
There you go. Trying to get rid of mine right now. We'll be back.
Good morning, everyone. We are at Spa Medica this morning. We're going to be doing some non-surgical procedures this morning. I told you about one earlier on. We're also going to be doing, in the first segment, something called Face Tight. It's exactly the way it sounds. It's a procedure that tightens your face. And Kev, they have lots of things here for men as well. Men get the same things as women. Botox, hair transplants, whatever you want. We're at Spa Medica this morning, and we'll see you when we come back.
And we will be back at 6:54 on Breakfast Television.
Welcome back to Breakfast Television. It is 7:11. So Jen Valentine has been at the Live-Eye this morning, and she is at Spa Medica. So Jen, this is what I want you to do. If Dr. Mulholland is there, I want you to tell him a big thank you for the Latisse. Latisse is something you put on your eyelashes, and it makes them grow. And I was skeptical, and I started using it, and you can't tell now because I have fake eyelashes over top. But if I took off the fake eyelashes, you would see how long my real eyelashes have become because of Latisse. I know you're there looking at a lot of non-invasive procedures, and they just get better every single year.
They really do. You know, Tracy, I'm going to tell Dr. Mulholland that in a minute, but there's lots of things that you can do just to give yourself a fresher look, like a photofacial or microdermabrasion, non-surgical procedures. But we're going to do one today. If you're a little bit queasy, you might want to turn. We're going to turn at one point. But come on over here. Let's talk about it first with Dr. Stephen Mulholland. Tracy Moore wants to thank you for Latisse, for that made her eyelashes grow. That really works.
It really does. Just topical application, 40% longer, 40% thicker. And so you can wake up with that doughy, glowy sort of eyelash.
Oh, very, very pretty. And you always look good. When you have longer eyelashes, it really does make a difference in your appearance.
Yeah, it's a very youthful thing to have long, lush eyelashes for sure.
The procedure that we're doing today, this is Jane, by the way, a country karaoke singer. We've been chatting. What's your song of choice again?
Guitar's Cadillac by Dwight Yoakam.
We're going to have to get you to sing that on the show sometime. Loves karaoke. Woo! What's the procedure?
We're going to do what's called Face Tight, and it's a little device. This is what it looks like. And as we were talking earlier, this is like ironing your skin. So if you've lost weight or you've lost skin tone and you've exercised, you've dieted, you can't bring that tightness back after babies, after weight loss, just with age. This is like ironing your skin.
We're ironing those wrinkles away.
Exactly right. The internal electrode of Face Tight goes under your skin, so you have to have local anesthetic like going to a dentist, and then we just go snap, 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 and without any cutting or any scars, you get tighter skin.
Okay, so we're going to turn the camera away when you enter the skin, just so people are a little bit queasy. So look over there, everyone. And what are we setting this to?
We're setting it to a specific temperature, so it constantly heats the temperature safely and effectively. So patients who do this procedure can literally go back to work the next day.
Okay, you know what? Let's take a look at the before and after while you do the entry. So this is a before picture right at the top here, and then right at the bottom, before is at the bottom, obviously, and then the after is right at the top. So this is the results that you can get with this procedure. Okay, you have entered the skin. What are you doing?
So what I'm doing right now is I'm slowly moving. Jane's in no pain. There's local anesthetic. And I'm basically applying heat under the skin. We've spent so many years developing techniques that heat on top of the skin. This is the first device that safely and effectively heats under the skin, which is far more efficient way to tighten. And so I move back across the area, and the heating tightens the collagen, tightens the elastin, the fibers that give our skin youth. And there's no bruising, no downtime. Patients generally go back to work the next day. And one treatment. It's not a series of treatments. It's a single treatment to bring back skin tightening and skin health. So the face tight's been very, very popular.
One treatment, you can go back to work that day, not very invasive at all. And this is a new procedure that you've been doing for about 11 months now. So what have the results been like over the last 11 months? What have people told you? What have you seen?
Well, it's been great because I'm showing the neck here today, which is very common, but loose skin of the upper arm or of the upper tummy after babies or of the inner thigh or above the knee. Techniques and procedures where in the past, as plastic surgeons, we go, oh, we have nothing for you. Now we can tighten skin.
So you can do this under the arm too?
Yes, that loose, that sort of bat wing skin, you can tighten that. Anywhere where you have loose skin and you're really not interested in a real surgical procedure, this is a great opportunity for tightening under local anesthetic.
And it doesn't hurt?
Jane, what's it?
No, I don't feel anything.
She'll be singing karaoke tonight. We'll see you when we come back. Non-surgical procedures this morning at Spa Medica, Kev. Hey guys, thanks very much. Lots of fun in the lobby this morning. Today we are at Spa Medica, getting ready for the summer with non-surgical procedures with Dr. Stephen Mulholland. We are doing a procedure that is going to help us with the belly fat, but it will help us in other areas as well.
Yeah, this is called the tight effects, and like the name implies, it gives you a tight effect, and it's a fat melter, fat of cellulite, fat of wiggly jiggly areas like the tummy, the pot, the saddlebags, the arms, inner thighs. Summer is coming, so tough to lose areas again with diet and exercise, but you don't want to do liposuction. This is the kind of technique that is very compelling for patients heading into summer with that troublesome area.
Yes, this is a troublesome area for a lot of women and men too. You can see a definite difference here. And is this the first procedure? Yeah,
this is Laurel's first procedure. You can see there's still the bulge on the other side. You get a flattening. The Tight FX emits a high voltage electrical current. It's very comfortable compared to other techniques, but it kills the fat cell in a safe way that your body can then metabolize it. So it's really very few contraindications. There's really no risks, and it's a series of treatments once a week for several weeks, and 3 or 4 centimeters would be the average reduction.
Okay, how much approximately a price range would something like this procedure cost you for this area?
When you look at the non-surgical treatments like Tight FX, generally they're less than half the cost of liposuction. So for a series of treatments on your tummy, it might cost you $1,500 to $2,000, or about what it costs for Jenny Craig or a Bernstein program, but you get to get a focal loss of contour. Like if you look at the before and afters here.
Yeah, and you always take before and afters always, when you with your patients, and these ones have definitely, they've signed off. So let's take a look at this one because there's a definite difference.
Again,
here.
Tummy, bra line, hip, very common areas. And clearly weight loss will be a component of that strategy for this patient, but if she tried everything and this was her weight, she'll feel much better in tight blouses or summer garments, summer wear. Same with this lady, a couple of kids, the tummy's a problem for her, and this is just a safe, non-surgical way to slim frustrating areas after weight loss, babies, and it's a tough thing to do on your own sometimes.
What does it feel like, Laura?
Feels like a mild electrical shock, but it's not. It's fairly comfortable.
Okay, good stuff. Well, we'll let you continue because we don't want you to be lopsided, just on one side and not the other. So we'll leave you to it. We don't want her to be lopsided, do we? Back to the station. Good morning. We are back at Spa Medica with Dr. Stephen Mulholland. We've been doing non-surgical procedures, getting us ready for the summer. Nobody wants surgery.
Yeah, you know, very few people are going to have a surgical procedure. The vast
majority. Some people will, but
some do.
Some don't need it.
Right, and you're absolutely right. You can nowadays with products like Juvederm Voluma and Botox and our photofacials, you can look 5 to 7 years younger forever without ever undergoing a scalpel-based procedure. It's kind of neat.
We were talking about weight loss, and when women or men lose weight when they get older, their face sort of sinks in. You should always be a little bit heavier, just because of your face. But we can do something non-surgical to plump up our face.
So as we age, you're right. Deflation from natural aging, or you exercise, you look great from the collarbone down, but gaunt and older from the collarbone up. So bringing back volume is one of the tenets of a youthful look and what we try to do in plastic surgery. The problem has been bruising. And so what I wanted to show today is this would be an example of a needle. We aren't going to do the injection, but you can see on the right would be the old-fashioned type of needle, which is sharp. And that would lead to bruising. Now we use these blunt tip microcannulas, and I can do lips, cheeks, inject anywhere on the face, and the
what
patient
are
could
you
go out that
injecting?
day. Usually we're using products that are safe and reversible. One of the most popular right now is Juvederm Voluma. Voluma will last up to 2 years.
Wow, that's a long time.
It is a long time. But if you thought it was too much, you need to adjust it, you can reverse it or take it down a bit. It's a
Lena's had stuff done on one side of her face. We can see it before and after here. What have you done with Lena?
Well, you can see that she's an exerciser. She keeps fit, and she was looking very hollow under the eyes, a bit tired, gaunt looking, and we injected a little bit of a Juvederm under the eyes, across the cheeks, subtle, but yet she looks rested, she looks fresh. And then you can match your face to your body if you happen to have lost weight or exercised your way into fitness and your face looks deflated.
And so what side are we looking at?
So if you look here, I injected about an hour ago her cheek and her lips. Now in the past her lips would be horribly swollen, she'd have to take the day off work, but with the blunt microcannula technique, you can inject products in the face and makeup on, you could go right back to work.
There you go. Thank you so much, Dr. Stephen Mulholland at Spa Medica. Another procedure when we come back. Back to you.
Thank you so much.
Thanks very much, Tracy. Good morning. We are back with Dr. Stephen Mulholland at Spa Medica, getting ready for the summer. Some non-surgical procedures. What are you doing right now, Dr. Mulholland?
I'm doing a procedure called the Fractora and the Firm. This uses tiny, tiny little microscopic needles and electrical current, and it creates little tiny pores and channels in the skin with the electrical current. And then I'll take some antioxidant type serum, and we'll put that on the skin. This is ferulic acid, which is a very good antioxidant. We're heading into summer, sun damage, brown spots, wrinkles. And then once it's on the skin, we'll take a device called the Firm. So the first one put little holes in the skin, microscopic.
Yes.
The second one actually moves in circles and pushes that product into the skin. So it penetrates, it opens up little pores, takes the skincare product, which is good unto its own, and pushes it deep into the dermis. The overall goal is tightening, firming, and wrinkle reduction, which is the Fractora Firm does. We did this side of her face already, and you can see it's a little pink, the cheek is full, there's a little ultrasound gel, but again, the type of procedure where makeup goes on, you can go back to work. It would be a series of treatments. Yeah, once a week for about 4 or 5 weeks. And you can usually take 4 or 5 years off. You can see these
4 or 5 years.
Yeah, a year a week. So 4 or 5 weeks, 4 or 5 years.
Okay,
and again,
let's take a look. I really want to see some before and after.
So you can see this would be a lot of sun damage, fine lines and wrinkles, and the Fractora facial evens out those, evens out the wrinkles, firms the skin, and again you can see the tremendous improvement in the quality of the skin.
Very nice. We got it over here as well.
And this individual over here, you can see the jawline, heavy jowls.
Yes.
And without any surgery, we can, and with the face tape we talked about earlier, still goes under the skin. This is a treatment on top of the skin to improve the contour and shape of the face and the appearance of fine lines and wrinkles.
Yeah, you can really get a closer look right here.
Yeah, tremendous texture improvement. So I would leave with this parting word. We're heading into summer.
Yes.
Stay out of the sun, and if you're going to be in the sun, wear a hat or wear sunblock, or you're going to need these treatments as well.
Okay, so that's really good advice. Wear a hat this summer, wear sunscreen. That is the most important thing that you can do for your skin. But there's always Dr. Mulholland. Thanks so much, Dr. Mulholland here at Spa Medica. For more information, just go to breakfasttelevision.ca and we'll have all the information. Back to the station.